Here we are Friday afternoon, still on the floor. And
Thursday?
Yes, in fact, it's Thursday afternoon. We're still on the floor. It's been a long week.
Seems like Friday.
I made the mistake of bringing shoes and thinking I was going to break them in at the show.
Oh, that's a bad.
That was a really stupid idea.
Yeah,
so tennis sneakers is the way to go.
Never do new shoes before a marathon.
Yeah,
and this is your marathon.
I should have called you ahead of time. So today we're with Wes Wright. I call myself a recovering CIO. You're a recovering CTO from a health system. Now you're CTO with Imprivata?
I was came out of Sutter about 10 months ago. Imprivata, I thought, and I saw things developing at Sutter that told me that identity is going to be the new perimeter. Yeah. And in healthcare, if you think identity, you think Imprivata. And David Ting, who was the founder CTO, left, and I never considered that I'd be able to take that spot, but because he is wicked smart, and I'm not, so I didn't think I'd have a shot at that. But lo and behold, here I am.
But the thing you have is experience.
Right. I've got about 25 years of provider experience, and in Imprivata, when I was on the CTO CIO side, I worked with Imprivata a lot, and I think anybody that does work with Imprivata, they'll go, oh, these guys actually get it. Yeah. They know workflow, they know healthcare. Yep. And that drove me here too. And really one of the major decision factors was, they bought Caradigm 2 years ago. Yep. So one, that gave them 140 customers, but two, what it then allowed is that with Caradigm came a provisioning system, a GRC provisioning system. We took it, rolled it up, modernized it, and now we have a new GRC provisioning system, which then allows me to have a suite of services so I can offer almost everything in the IAM suite.
That's pretty cool. So here's what we're going to do.
Okay.
Recovering CIO, 16 hospital systems, so we used Imprivata pretty extensively. We also were one of the first clients for Caradigm.
Okay.
And that didn't go nearly as well as the Imprivata.
When I was at Scripps, I bought Centillion. So
well, there you go.
There you go.
We all have a history.
Yep.
So what I want to talk about, really leverage your CTO background and say, the listeners are primarily healthcare provider, IT organization type people. The world's changing on that.
Big time.
So especially so let's talk infrastructure and operations. Let's talk back office. So you say identity is the new perimeter.
Yeah.
So how are we going to start seeing identity play out in terms of provisioning of new services and those kind of things?
It will all be identity based with the new FIDO standards coming out too. Identity is just identity without a password. Everything, it's identity and data. The identity of the data producer is where that perimeter's.
And it's all being driven by security.
100%.
So how do we get to a point where there's no password?
It's in the cloud world, you're almost there. We've been doing a lot of work with Microsoft. I had a conversation with them a couple weeks ago, and they've got some FIDO stuff. You just, the FIDO fob, like the YubiKey or something, you plug that sucker in, you never see a password prompt again. But that's really only aimed at the cloud application stuff. Like, it doesn't work with applications that are LDAP stuff.
So you probably struggled. I mean, you were CTO in Sutter was what, 10 billion?
About 12 billion, 28 hospitals.
28 hospitals. And your biggest security threat is people.
People.
Right. So, and people know their passwords, and then they use it over and over again throughout the internet, and then they create all sorts of challenges that way. Are you guys looking at the larger identity across all the applications, or are you really focusing on the clinical applications?
We're laser-like focused on the clinical applications. That's what's made us our money. That's our secret sauce. Not only from an identity perspective, but it's the workflow integration that really makes. In Epic, there's I think about 140 different places in Epic where you can call for a second authentication, and we know them all and can prompt for that second authentication. So it's really the laser-like focus on the clinical applications, but what we've come to realize is, hey, we've set up this great SSO, AMSSO situation for all our clinicians. And then we got like a second tier community that has to still use username and password. So we'd really like to see people using Imprivata in enterprise. So for non-clinical users, we've really done some huge price reductions for the non-clinical users so that people like me, the operating people, only have to manage one pane of glass from an SSO perspective.
Yeah, are you finding that, are you guys able to drive higher efficiencies? I mean, clearly that's one of the reasons we used you was, you took the login times way down for us, and the clinician experience obviously goes up.
Obviously,
But do you find cost being one of the major drivers right now within healthcare?
Oh yeah, about every other CTO, CIO I talk to really wants to expand their VDI, but it costs a lot of money in hardware and licensing, and they can't expand that even outside. They may even have just a little pod for an operating clinical section, and that's the only people who can use it. Why? Because of cost. I think there's going to be some big breakthroughs in that area here pretty soon, though.
Well, it's interesting. So it works. It's technology that works. It works in a lot of different areas. It drives satisfaction, drives efficiency, and clinician experience is huge.
Yeah.
Physician burnout and whatnot.
Yep.
You would think, hey, this is a working, great solution. We roll it out. Do you guys help people to build the business case to go back in and say, look?
From a VDI perspective, not really. Sure, we build the heck out of the business case on the AMSSO or EPCS or any of our product type stuff. Because I've done a bunch of VDI, I'll offer, hey, I'd do it this way if I were you, or this way if I were you. But other than that, nothing really formal from an ROI perspective on VDI.
So what's the CTO? The landscape's changing in healthcare IT.
Oh yeah.
What are some other areas where you're just seeing it change pretty dramatically?
I'm seeing a real bifurcation in your IT stacks right now. I mean, there are two camps, two really solid. You're either Dell, AWS, or you're on the Microsoft stack. And what I see is a lot of people making what they think are tactical decisions, but are really lock-in decisions in one of those camps.
Yeah.
So that's a little concerning. And I try to talk to people enough to where they know, hey, if you make that MDM decision, you've made an MDM decision for your whole enterprise. You can't do anything around that.
But it really is a data decision at this point, because you're trying to tap into Azure and AWS, machine learning, AI capabilities.
Right.
Like
Yeah.
Is Google playing that, or not as much?
Well, yeah, Google plays in it. We haven't seen Google from a cloud perspective as much as we've seen AWS and Azure, of course, but Google's there. Google really wants to come into healthcare. Matter of fact, we just did a press announcement at this HIMSS that you can tap and go into a Chromebook now.
Oh, really?
Yeah.
That's pretty cool.
Yeah.
So you have the three stack. You have those two stacks.
Yep.
And the Microsoft stack just ended up being a default, right? Because you take that MSA every year and you just go, I'm just going to add cloud, or I'm just going to add whatever, and away you go. But that's a really bad way to make that decision, isn't it?
It is. What's really driven, I think, Microsoft's enterprise business and their O365 and Azure business, it's Exchange Online. I mean, that was the easy decision.
Yeah.
And that was, I can spend a whole bunch of money and put 4 or 5 resources on-prem to manage Exchange, or I can just put it in the cloud.
Yeah, I want to be real clear, because I was a huge Microsoft fan and stack. The Azure stack is a really good stack.
100% agree. Everybody knows I'm a Microsoft fanboy.
Oh,
yeah,
really? Okay.
yeah.
But the Amazon stack is also a really good stack. The challenge we had was talent.
100%.
Right. So we just had a wealth of Microsoft talent, and it was a natural progression to get here.
Yep.
But you were in San Francisco. You couldn't get Amazon talent.
I was in Sacramento.
Okay.
Yeah. And yeah, I guess I could have, but I think to this day, Amazon doesn't have a BAA in California.
Oh, okay.
Yeah, so that's a little concerning. And I came from Seattle Children's, right across the river for 7 years from Redmond, so I had developed a bunch of Microsoft relationships and knew I wanted to use the Microsoft stack because I knew the Microsoft, much like you, I knew that stuff. I didn't know the AWS stuff very well.
And the BAA was when Microsoft finally decided to do the BAA.
That was huge. I actually at Seattle Children's, I helped with that a bit.
Well, I mean, back in 2010, 2011, we were building out our cloud environment, and we went to the major players with the concept of BAA, and they looked at me like I was insane.
Cross-eyed.
And so we ended up building out our own, essentially our own internal cloud on VMware stack. And
private cloud.
Exactly. It was a private cloud, and then what's interesting is VMware kept building all these other things, and so now you can actually get out into a public cloud. I'm not saying we knew that was going to happen. We sort of got lucky.
Hey, sometimes it's better to be lucky.
Pick the right vendors, and they will figure out the future for you. So it's interesting. So HIMSS, those are the stacks.
I think the big disruptor that's coming out right now, Windows Virtual Desktop.
And why is that?
Because you only pay for compute and store in Azure, and no other licensing cost.
Yeah, anything that changes the licensing model will be interesting. But I can't imagine it's going to drive down the licensing costs.
Yeah, it will for us if I don't have to pay a Citrix license or a VM tax.
Oh, yeah. Okay, I see what you're saying.
Yeah.
So we were a significant Citrix shop.
So, it sounds like we're a lot the same here. That's what I ran too.
Well, it's interesting because Citrix is starting to get into that identity space and essentially saying, look, to a certain extent, you can get rid of some of the licensing around badging and that kind of stuff.
Yep.
So do they end up becoming a competitor or something?
Not really. We still have a pretty good relationship.
Because you guys are really deep in the clinical side.
Yep. We do a lot of work with them, of course. Sorry, on the receiver and that kind of stuff. Yeah, we are with both Citrix and VM. We have a really good relationships because really it's our VDA product that allows those VDI stacks to work. So it's a pretty symbiotic relationship.
So one of the interesting conversations I just had was a lot of mergers going on, a lot of displacement within healthcare and whatnot. Let's talk career here for a second. So you've been on the provider side, now you're on the vendor side. When these people get displaced, you could go in the vendor direction, you could go in the provider or consulting back end and those kind of things. What would you tell people who are trying to make that transition?
The just I got displaced transition, or the transition to the VAR side?
Because it's happening a fair amount.
It is, but I also see there's a fair amount of the old gray hairs that are retiring now too, that just don't want to mess with.
I'm not going to take it personally.
No, you shouldn't. You're just gray haired, not old.
No, that's what. Yeah, I am not as old as some of the CIOs who I've been talking to.
Exactly, that's what I mean. Those people are starting to retire because with the new high tech and the interoperability, they just go, no mas, I'm just tired of it. And that's creating a bunch of opportunity out there, I think, that people need to just be aware of.
Yeah, I asked John Halamka what he's looking for in a CTO. He said, I'm looking for somebody with very little gray hair who's going to really push the envelope. Somebody who's going to be...
I think every CIO is looking for that. Yeah.
Well, are they out there? I mean, are they...
Yeah, there's a few. There's a few out there. I think somewhere in our CIO career or healthcare CIO career, we decided that it was better that a CIO really know the business more than the technology. And I think we did ourselves a disservice. That's why I think we see a bunch of the non-healthcare CIOs coming in, because they know their technology stack really deep, and then can apply that to the business, where we have been going, let's know the business really good and see how we can use the IT staff. The non-healthcare world goes the opposite way. So
CIO, traditional, chief innovation officers we've seen come up, chief digital officers come up.
Yep.
And I think part of that is what you're describing is that the CIO said, "Hey, I want to be at the table and I want to know the business." Well,
Right.
that's all well and good, but we need to get stuff done faster.
Yes.
Than we've ever had before. And so if the CIO is spending all this time on the business, somebody needs to be looking at architecture and saying, hey, you know what, in order to be agile, we need architecture.
And I've worked with Drex in several different places, Drex to Ford in several different places. That's exactly how we separated things. I mean, it was like, okay, he goes up, I concentrate on down. And that's what you need a CTO for. If you're going to focus on the business, then you need somebody focusing on operations and the IT stack and the innovation.
Yeah, for sure. Wes, thank you for your time.
Oh, my pleasure,
Wish
Bill.
I grabbed you yesterday, man. You were really dressed up. You had
I had
a hoodie on.
I had my what I call my Imprivata uniform on. Red shoes, red shirt, red hoodie.
Wow.
Yeah.
It looked pretty wild. It looked very California.
Thank you. That's what I was going for.
Great hanging out with you.